So, welcome to another episode of Nurse Ease, Nursing Made Easy. And today we're going to take our next step into that fundamental portion of um, that first semester, things that you're going to be learning. So, our lesson 5 today is going to be on client education. So, what is client education? Client education is your way or the way that nurses help families and patients learn how to respond to the problems that they're dealing with and how to protect their health. And that's probably one of the most important functions. Many patients really lack that knowledge to engage in that self care ability. And so, to work effectively with these patients, is our responsibility to be skilled teachers and also counselors. And we do that by using strong communication skills. Today, current trends towards are trending towards just having a shorter stay. And so I guess that maybe not to guess, but to assume it's really about decreasing that time within the hospital. But within that time in the hospital, by decreasing that time, that also decreases that time that they have with you. And so it's very important from the very beginning to make sure that you're working very hard to increase the need to provide them effective teaching and counseling based on what that health deficiency is. By doing so, you not only engage in health promotion, but you also empower them to take better care of themselves. And by doing so, you kind of decrease the cost that they actually spend on health care. So when it comes to client education, it's that way that we influence the patient and their families to change based on the knowledge that we give them, change actually they're gaining knowledge, but also they change their attitudes and their skills to be able to maintain that health. So make sure we're educating them, make sure that it's ongoing and interactive, make sure that we're engaging in plan of care and developing some type of collaboration through tools that we have to that are provided for us to help them achieve that health goals. And the biggest part of that is going to be education. Back in 2018, there was a Speak Up initiative, and that goal was to ensure that patients and family receive the information they need to have that optimal health, to address any understanding of their health issues, the disease process, the treatment, how to make informed decisions, and to promote a healthy lifestyle. The aim at teaching and counseling is all about promoting their health, preventing illness, restoring them back to a health, and facilitating their coping mechanisms. What are our outcomes when we want to give them education? Well, the biggest one is we want them to have or attain the highest level of wellness, and to engage in self-care practices. And by doing so, they prevent diseases or engage in early detection of diseases. If we do so, there's a quick recovery from trauma or illness. It enhances their ability to also adjust to developmental life changes, whether it be acute, chronic, or terminal illness. And the patient, along with the family, begin to engage in an acceptance of a lifestyle that is necessitated either by that illness or disability. So we focus on patient education by preparing for receiving care, preparing them before discharge, and documenting that education activity that we engage in. So when it comes to teaching, there's an acronym. Your book may talk about it. I'm not really sure which one you use, but a lot about that teaching is tuning into your patient, making sure that you edit any information that's necessary, act on each and every teaching moment that you have, clarify, and then honor the patient as a partner in the education process by including them. One of the other things that's going to be really important is engaging in effective communication techniques. So I'm not sure whether or not I talk about this in an earlier podcast, but it's really going to be important that we be sincere and honest. Make sure that we're very genuine in taking an interest in them, and then also reciprocating respect for them. We don't want to give them too many details, but we just want to stick to the basics. What's within our scope of practice. You don't want to go beyond that. Ask them, Do they have any questions? Be a cheerleader for them. Use simple words, vary your tone, keep it clear and concise. Listen and don't interrupt when the patient speaks, and ensure that the environment is conducive to learning and free of any interruptions. And always be sensitive to the timing that you decide that you're going to help them or teach them, especially based on their age development. So, especially if it's a younger child or if it's adult, make sure you choose an opportune time that's going to be good for them so that they maintain that information. When it comes to learning, there is cognitive, and that's the way we store and recall information into our brain. Psychomotor is the way we actually engage the body in actually doing, by like moving our arms and legs. So maybe we teach them how to do something and they demonstrate that back. And then effective is about changing attitudes, values, and feelings. So, for an example, your patient may, after having physical therapy, be renewed to some type of self confidence, and that's that effective portion. When we think about um, factors that affect patient learning, it can be age, it can be their developmental level. How much support do they have from their family? What's their network like? There are times when we're working with our patient that we have to be thinking about whether or not they have everything they need financially. Are we taking into consideration their cultural background? What languages? Is there a deficit that may keep them from really connecting with the education and teaching that we're going to give them? And then asking them what literacy level they are. And a lot of times that's an assessment question that we ask. And so sometimes you can go back into the computer and actually look that information up without um, putting the patient through unnecessary questioning. There are some tools that you can use out there, um, but for the most part, we want to engage in critical development areas, like as far as physical maturation and their abilities. We're going to be developing their psychosocial skills, cognitive capacity, their emotional maturity, and then their moral and spiritual development when we use some of these tools that are out there and they're available. The biggest thing that I talk about, and I want to make sure that I get this clear, that there is a nursing process, and we're going to run through that. But just remember that as we move into the clinical judgment model, understand that it's not a straight line, that it can bounce, through either of those processes, depending on what the patient is going on. And it's up to you to recognize those cues that says, I need to move to another step. And your questions will show you that too when you're answering those. So we're going to start with assessment. Look at knowledge, attitudes, and skills needed in order for them to be independent. Do they show you a readiness to learn? Do they have the ability to learn? And then what are their learning strengths? When you're assessing their readiness to learn, that patient is willing to engage in a teaching learning process and to begin that challenge of learning. So making sure that you promote patient motivation, make sure that the patients view themselves as being able to assist themselves engage in self-care, and help them to um, deal with their emotions when it comes to their serious illnesses. Promoting compliance is about assessing their learning needs, making sure that we're developing a plan of care in which the patient actually can and will comply. And we understand that the patient control the choices about how they're going to follow that plan, but the nurse is really the one who's responsible for helping them improve that knowledge and make informed decisions, but making sure that we're also including them in that process. With nursing diagnosis, this can include in that nursing process is making sure that through our teaching process, we're addressing the fact that they may have ineffective health maintenance or therapeutic regimen management or be non-compliant, or may have self-care deficits. So our education, when we're even though those are your nursing diagnoses, your goal is to overcome those by making sure that we give them what they need to actively participate in their health maintenance, to be effective with it, to be compliant, and not to have any self care deficits. By implementing, we want to be promoting patient learning by using a warm and accepting approach. Avoid taking a condescending attitude and using technical and medical terms unless that patient does have a background in it. Consider the physical environment when implementing your teaching plan. And just remember that some planning may be needed to ensure adequate space and lighting, comfortable chairs, good ventilation. Privacy is also important, as is their freedom from any distractions and interruptions, to make sure that they're actually benefiting from what you're giving them. Review um, the patient's expectations and role functions as a learner. Assess whether or not they have a comfort level. Be prepared and be organized before implementing any teaching plan that you have, and make each learning session interesting and enjoyable for your patient. Making sure that you're culturally competent, you're going to make sure that you're taking into consideration what their cultural needs are. Don't make any assumptions. Avoid your biases and prejudices, and develop written material in their preferred language. Making sure that, again, you're identifying any barriers, especially with your older patients, allowing them extra time, using short teaching sessions, accommodate for sensory deficits, think about environmental distractions, and relate that new information to a familiar activity that's good for them. Um, and I will tell you that, last but not least, some teaching strategies that you can use when you're working with your patient include lectures and discussions, demonstrations, role playing. You can use audio, visual materials, printed materials. You can also use website instructions and technology when working with them. And just remember to consider that as well with your children, using different forms that are good for them, and then coach them by making sure, no matter who your patient is, that you're establishing relationships and identifying their readiness, identifying these opportunities and issues and concerns that may be presented to them, and then establish patient-centered goals, um, empowering them and motivating them to reach their goals, and assisting the patient to determine progress towards those goals, and then obtaining feedback from that learning experience that you give them. And then, last but not least, you have to document what they've learned. Um, Common mistakes, though, that we can make is ignoring the restrictions of our patient, failing to accept that the patient has the right to change their mind, using medical jargon, failing to negotiate goals, duplicating teaching that other people have already done, overloading them with information, choosing the wrong time for teaching, not evaluating, not reviewing, and failing to really document information. So when you take that all into consideration, you're going to use all of these guidelines to best help your patient in your client teaching. And that brings us to the conclusion of this episode. Until next time, stay tuned, keep learning, keep sharing. And if you have any feedback, feel free to let me know. Feel free to not only like, but subscribe and share this with your closest classmates.